Lately on our Instagram, we've been discussing how schizophrenia may have an impact on other mental health disorders that one patient may have. Let's start off with one of the biggest and most common co-occurring mental health disorders that a schizophrenic person may have, which is anxiety. When a person is going out into a public situation and feel like they have high levels of social anxiety, this may not mean anything to anyone, but if this is paired with other symptoms such as hallucinations, this can be a telltale sign for schizophrenia. The antipsychotics that are used to treat schizophrenic patients may also increase their anxiety levels, which can alter with the brain's neurological processes. When a person is recovering from schizophrenia due to their past hallucinations, they feel like they may be in a constant state of stress and anxiety, which is why schizophrenia has a major effect on people with anxiety.
The second mental disorder that can affect schizophrenia is OCD. When a person may be developing schizophrenia, which is the premotor stage, one of the first signs of getting diagnosed could align with the symptoms of OCD. In case you didn't already know, OCD is the obsessive-compulsive disorder. And an example of this could be when a person feels like they need to do a certain action a number of times in order to feel fulfilled, and nothing would happen to them. When being diagnosed with both disorders at the same time, OCD could increase the level of risk to the schizophrenic patient. The patient could be feeling overwhelmed by multiple things at once, and it makes it much easier to have a mental breakdown.
Moving on to another mental health disorder that may have an effect on schizophrenia is depression. Symptoms a schizophrenic or any person may feel is withdrawal from outside activities, but with a mix of other symptoms such as hallucinations, like mentioned before, that may be the main sign that you have schizophrenia. Some patients have family history that may affect their ability to get schizophrenia. Certain gene strands can mutate, which causes the inclination to get schizophrenia. These same gene strands can also cause an inclination of depression, which is why they're easier to be co-occurring. Another reason a person may have both schizophrenia and depression is due to things such as bullying. Bullying is one of the external factors that can cause depression in not only schizophrenic patients, but anyone. Since normal people aren't highly educated on the factors that may cause schizophrenia and why they act like they do, people tend to pick on them, which can cause things such as suicidal thoughts and attempts to self-harm. Because of the lack of understanding, about 20% of people who have schizophrenia attempt to commit suicide, and 6% of people who have schizophrenia succeed in committing suicide. There is also another disorder called schizoaffective disorder, in which you have main symptoms mix of both schizophrenia and depression in one. This may be a very serious diagnosis, and to further consult, you should talk to a doctor if you feel like you may have this.
The fourth mental disorder that affects schizophrenia is PTSD, post-traumatic stress disorder. PTSD and schizophrenia have a symptom overlap, which could include psychotic symptoms such as hallucinations and paranoia, which can affect your day-to-day life. And both can also have a disassociation from reality, and you can get flashbacks, which can lead to complications of the diagnosis. A risk factor in schizophrenia that could increase the likelihood of you getting both PTSD and schizophrenia is increased childhood trauma. Past trauma is a major risk to being diagnosed with either condition. If you know that you have both PTSD and schizophrenia, it's important to let your doctor know so that they can help you take the right course of action, because the treatments for both PTSD and schizophrenia are completely different and can be different when they overlap each other.
The fifth mental health disorder we're going to be talking about is BPD and the similarities and differences it may have with schizophrenia. BPD, or borderline personality disorder, means that a person's emotions and expressions can change very quickly. It can cause things such as insecurity, instability, and may cause major mood swings, which can affect a person majorly. These symptoms can sometimes overlap with schizophrenia. In severe cases, it can lead to damage and end you up in the hospital. BPD and schizophrenia have many overlapping symptoms, but of these many, there's three that are major. Firstly is mood instability. Both can experience things such as major mood swings that can cause them to act recklessly and have breaks. Secondly is paranoia or disassociation. In BPD, these are more common when they're having major things such as mood swings, but in schizophrenia, it is more spread out throughout their day-to-day lives. And both can experience identity shifts and how they perceive reality, which may later lead to confusion when they are trying to get diagnosed. Like any mental health disorder, they have similar risk factors. Genetics can play a major role in whether someone is diagnosed with schizophrenia, BPD, or both. There's certain gene strands within the body that are able to increase the ability to get certain mental health disorders, and they may overlap, causing a person to be diagnosed with both BPD and schizophrenia. A child's trauma can also affect their mental health and how they grow up, so this can play a major role in their environment and how they're able to surround themselves with other things in certain social scenarios. Also, neurological factors such as the misfiring of certain neurons within the brain can increase the likelihood to get schizophrenia or BPD. Although BPD and schizophrenia are two disorders, the likelihood of getting them is higher when you have another one of them. The likelihood of a schizophrenic patient to experience symptoms of BPD is about 10 to 20%, and about 1 to 4% of these 10 to 20% experience full-on BPD, which can lead to further complications within their diagnosis and make their schizophrenia much worse than it was in the first place.
The sixth and final mental disorder that we'll be talking about is how bipolar disorder could have an effect on schizophrenia. Both schizophrenia and bipolar disorder share many of the same negative symptoms, which include psychotic symptoms and maniac episodes. And because both disorders share many of the same symptoms, it could be hard to tell the difference between both during diagnosis. When an individual gets both types of disorders, they could be diagnosed with schizoaffective disorder, which is the bipolar type of schizophrenia. And both disorders have similar treatments such as antipsychotics, psychotherapy, and mood stabilizers.
And that's it for our second episode of the podcast. I hope you guys enjoyed watching and stay tuned for our next podcast episode.